Welcome to Dr. Nancy RN, Healthy World, Healthy Nation, Healthy You. I'm Nancy Valentine, PhD and registered nurse, and this show is dedicated to you, the healthcare consumer. And today we have a topic having to do with your affiliation and your relationship with your primary care team, or your physician, or your nurse practitioner, or your physician assistant, all of whom comprise your healthcare team. The name of our show today is Overcoming the Power Differential, joining your team of healthcare providers. And we are going to define that term, power differential, because that may not be something that you've even heard of and have no awareness that it's really occurring. But we're going to tackle this head on, because this power differential and how you feel in the context of that healthcare team and where you think you fit and what is your place in that is exactly what we're going to be talking about today. And our guest today to really lead us through this conversation is Adrienne Banning. Adrienne Banning is a physician assistant herself, and she is working as an assistant professor and working as a physician assistant clinically, and she works at Drexel University College of Nursing and Health Professions, and she works in the physician assistant department of that fabulous school. So thank you, Adrienne, for being with us, and it's a delight to have you. I think you're our first physician assistant, as a matter of fact, on our program, so you're breaking some new ground for us, which is wonderful. And I think that since our title is Overcoming the Power Differential, before we can overcome it, we have to know what it is. So tell us what the power differential is and why you are passionate about this topic.
Right. Well, first of all, thanks for having me, and I'm so glad to hear I'm the first PA on the show. But I am really passionate about overcoming this power differential. And what it really means to me is that sometimes you feel like an equal participant at an office visit. But sometimes without knowing it, you might actually feel that the healthcare provider is really the person in charge, and you just are there to kind of take directions or take orders. But really, I think a team approach where you feel like an equal member of the team is really important and provides for better healthcare outcomes.
Well, that's really a good reason that we are having this as part of our discussion. But I think this power differential for many people is something that is almost unconscious, don't you think?
I do think so, right. I think that it kind of depends where you come from, your cultural background, or maybe even geographic background, and maybe your age too sometimes can really play a factor in it. You might not even realize that you're giving all the control over to the healthcare team without taking an active role yourself.
Right.
Yeah.
So as part of what we're going to be talking about and focusing in on today is, with this power differential, from your eyes as a clinical practitioner, where you are providing services, tell us and give us an example, if you can, of where it works against people if they are really being influenced by this power differential, and then maybe you can give us an example when people have overcome this power differential, how it makes a difference.
Well, I think if you're influenced by it, if you feel perhaps consciously or unconsciously that you can't answer questions about your own health, you might not be asking the right questions about your own health. So it can hurt someone if you don't really know what's going on, why you're going to the next visit that you have scheduled, why you're having certain tests done, or even why you're taking certain medications. If you understand why all of these things are happening, then you can kind of see what's going on at home and how you might need to make adjustments. Because when it comes down to it, you're really the only common denominator in your own healthcare. You might see your primary healthcare team, or you might see a specialist, even your dentist or physical therapy, cardiology, and the only common thing in all of that is really you. So if one healthcare provider changes a medication, you really want to know why and then share that with the other healthcare providers. So where I've seen that work the best is when people record their own information for themselves. Of course, we're keeping medical records, but if you keep a binder or a notebook yourself and know what medications you're taking and why, what lab results you've had and why, and keep a record of them, it really heads off all those small, maybe even errors or confusion that can occur when you see a healthcare provider.
Right.
Yeah.
And we've tackled this topic before in other shows in different ways. And I think one of the things that we've really said, Adrienne, is that we're really asking people to take more responsibility for their own health and welfare.
Absolutely.
And I think that is part of this change as well. And if you put that together with some of the cultural pieces of people being intimidated, particularly by physicians, because of their stature in our culture and many cultures, it really just gets very confusing for many people as to what is my role as the patient. Are you asking me to do more because you don't want to do it? Or are you asking me to do more because it's in my best interest? And how do you think people are going to get over some of these hurdles?
That's a good question. Your healthcare provider, I don't think, is asking you to do more, certainly because they are feeling lazy or that they don't want to do it. It is
Hopefully
absolutely,
not. Right.
it is absolutely in your best interest to be your own advocate. It might be you yourself, or that you bring someone along who can be an advocate for you. And it is something that might be difficult to overcome, like you said, because there can feel like this power differential that the physician or the healthcare provider in the room seems to kind of have this place of power. I kind of think of myself as just being someone in the room who happens to have had a lot of medical training and knows a whole bunch of medical facts and is staying up to date on evidence. And I see you as the person that I'm happy to help. But I need to know more about you to do that, and you're the expert on you. I might be the medical expert, but you're absolutely the expert on you, and in the end, that's who we're there to help.
Right. I think that's a good point that Adrienne just made, because what she's saying is, as a physician assistant, for her to be able to diagnose your situation, to really be able to know what are the best medications for you, the more you give to her in terms of information, the more comfortable you feel in talking with her, the better she can be in really being an advocate for you and really helping you to sort that out.
That's right, Nancy. And so I think by doing that and having those conversations where you're asking things of your healthcare provider and you're seeing what kind of answers they give back to you, you are developing a relationship and a bond that's really important to move forward so that you can have trust in each other. And I think that's one of the ways that you start to overcome this power differential, when you start to see yourself as a partner in your care, because you can learn a little bit more about each other in those interactions.
Right. And I think I want to put a fine point on this, because it can be easy to, I think, overlook, because a lot of people put a lot of faith into their team, and especially their physician, because they feel doctor knows best. So like, why should I be asking too many questions and taking up that person's time? Or maybe I'll ask something that's silly, and they'll wonder, why didn't I already know that? Or just something as simple as, if they want me to do it, I should wait till I hear what they tell me to do, and then it's my job to do it. I mean, all those barriers, I think, get in the way, especially when you're having a short period of time for your visit. Right.
It's true. All of those things, I think, are normal things that people think and have thought. Like you said, you might think that the doctor, the healthcare provider, knows best, and certainly they do have a lot of medical information, and they should be up to date on all of that medical information. But just because one treatment works really well for someone doesn't necessarily mean that it would work well for someone else. It might not fit your budget. It might not fit your lifestyle. It might not just be something that you want to do. So to have those conversations and tailor your treatment, your testing, your health care to you as an individual is really important. And medicine isn't just always one size fits all.
Right.
So that's why knowing about you as an individual is really important, and knowing your opinion on whether you want to pursue a certain treatment or medication really is helpful in helping tailor it for you so that it works best for you.
Right. Well, I think that one of the things that we're also talking about is the cultural influence, and it really makes me think of a conversation I had recently with a colleague who has done a lot of work in Gambia. And she brought this example to my attention of some of the work they're doing with some of the native women in Gambia, which is a country in Africa. And in that culture, a physician is seen as very high up in rank, and therefore a village woman does not really speak to the doctor, certainly is not asking the kind of questions that you're championing, because they are so intimidated, and even to the point where there's minimal eye-to-eye contact. There's such a deferential relationship. So because this really does get in the way of good health care, as we just heard from Adrienne, whether you're here in the United States or you're in Africa, they decided to do some intervention with the village women. And the way they did it, which I think is really worth sharing because we can think about how we could do this ourselves. They actually had role playing, and they used actors that were posing as physicians, and they were helping the women to be able to come up with different approaches so that they could talk about their healthcare concerns and they could learn about how to do this comfortably.
Right.
This was a very big change,
Wow.
but it was well received by the physicians because, as I've said many times, physicians want to help people.
Right.
They want to be an advocate, and
Right.
the whole team wants to work together.
Right.
So this whole change is really becoming not just a change in the United States, it's not just being driven by healthcare reform. This is really a global phenomena, something that's changing that really people have to get more engaged with their own health. And that's a big theme of what we're talking about today.
Right. That you are a participant on your own healthcare team and that it's okay to ask questions and you shouldn't be embarrassed to do it. And certainly here in the United States, your healthcare provider will feel comfortable with you asking questions, certainly if you don't understand something. So it is a movement to make informed decisions and for patient advocacy so that you can advocate for yourself. And maybe if you are learning to overcome some of those boundaries, maybe you bring someone along who can help you facilitate that at first,
Right.
and then later on you can do it more yourself, or you always come together with someone as a second set of eyes or ears to help you advocate for yourself. But here I can say that your healthcare provider shouldn't judge you for asking questions and making sure that you understand your treatment plan as clearly as you need to.
Right, so I think the key takeaway point here is that this power differential, or power grid as some people refer to it, is that we really want to wipe out that power grid. We
Right.
want to give the power to you
Right.
as the consumer. You are buying these services, you are paying co-pays, your insurance is picking up the rest of it. So even more than ever, you need to be well informed so that you can use that information. So there really is no rank. There may be perceived, but this is part of this conversation, is to help you really take that barrier down. The other is there is no fear factor here. There's
Right.
nothing to be afraid of. It may be something where you're uncomfortable. It just seems like something that is not easy for you to do. But I think Adrienne's suggestion that you do some work and bring some with you, or you take the suggestion I learned from this woman who did work in Gambia, that you role play. I mean, that's possible. You sort of practice at home at your kitchen table
Sure.
before you even get to the appointment. So you know you have your list of things that you want to cover in that appointment.
Right.
And I think to that end, you were going to share with us some key questions that have come out. Even the government is helping people figure out how to frame some of this, right?
That's right. Right.
So you want to walk us through some of these key questions coming from the Agency for Healthcare Research and Quality, which is part of the government that does a lot of work on quality factors and really what helps people to get better. A lot of their work is in the area of consumer sensitivity and helping consumers be advocates for themselves. So tell us what they are putting out as a guideline.
Right. Well, they have put together a list of 10 questions that every patient should know and every patient should feel comfortable asking. And if you go to their website, they have a tab actually for patients where you can sign up for regular email updates and get information that comes to you to help you move forward in this process and stay informed on healthcare information. But even before we go into that, you made a great point earlier, Dr. Nancy, when you said to make a list of the things that you want to talk about at your healthcare appointment. So that's a little bit of role playing that even you can do kind of in your head. You don't really need someone else to do it, just where you're imagining what you're going to talk about that appointment, 1 or 2 or even 3 of your most important things. So making an agenda to go in. Your healthcare provider might have their own agenda too, and you talk about that at the beginning to know that you're going to use the time most effectively. But AHRQ, as Dr. Nancy said, has put together a list of questions that you want to feel comfortable with asking. And to start off, a lot of times we have tests or blood work drawn, and we might not know exactly what's being tested for. You kind of assume that maybe they're checking for your blood glucose or sugar, or they're checking your cholesterol. but that's a pretty big assumption. So you want to ask, well, what is this test for? And then when will I get the results back? I like to say that sometimes people say no news is good news, but that leaves a lot of room for something to kind of go missing. It might not be your best bet, even if it is the usual policy of your office. I like to have my results even if they are completely normal and there's nothing to worry about, so that I know and that I can keep a record of them myself. It's always great to ask for a copy of those things. They're your health records and then you have them. So maybe if another provider wants to order some tests, you can say, oh, well, I just had these done 3 months ago. Are any of these things something that you would want to be testing for, so that you can save money, keep the cost of healthcare down, and also, though, that you're just not having repeat tests done? If you are having a procedure done, you want to know how often the person who's doing it has done it before, because you certainly have the power to choose who does your procedures and where you go to have them done. So asking for information like that is fine.
Now, I would think that one's a real hot button, because, again, when you go to a physician practice, and again, no matter who you're seeing, whether you're seeing the physician or part of that team, they usually have their usual referral sources.
Right.
Whether it's to a specialist, they have their usual cadre of people that they are used to working with. They'll say, well, I'd like you to be seen for dermatology, go to this doctor, or cardiology, go to this doctor, or you're going to have a procedure done. Asking those kinds of hardball questions.
They are.
Now, just walk us through that. Just give us an example of what would be the usual kind of a test, just one example, there's so many tests, and what you would see someone actually asking.
I think that this question is really probably most important when it might be a new procedure or something that's kind of cutting edge. I think if you're having a biopsy done, say you have an unusual skin change and someone's doing a biopsy, if you're referred to dermatology, you assume that's kind of their bread and butter. You know that they're doing that a lot. I think you'll find that a lot of times the answer is, I've done this thousands of times. This is really what I do all day long. But if it's something that you've never heard of or you know happens to be a new procedure, I think it's okay to ask that.
Can you give an example off the top of your head?
Let me think of an example off the top of my head. There might be a new surgical technique that's being done, and someone says, hey, this is a new technique that we're just starting to use here at this hospital. Maybe it's a certain kind of way to fix a heart valve. How many times has it really been done here? I think it's okay to ask, because the healthcare providers are asking that of themselves as well.
Right. So that's I think a really good question, but that would be one I think some people would have a hard time getting over.
I want to be clear that none of this is meant to be adversarial.
Right.
It is really being a part of the team and not being opposing sides of the team. So how you ask questions and how you approach something is just as important as that you're asking them to begin with. So when I'm encouraging to be a part of the healthcare team, when you're all on the same team, you're working for the same goals, and not really to be me against them. That's never the goal.
Right. I think that's important, because to ask questions that you may think you should know, or the doctor would think you should already know that, or you shouldn't be asking them to begin with, would be somewhat of an analogy, would be if you had your car and it had to be repaired. Would you take it to a mechanic, for instance, who was just opening up shop, you had never heard any recommendations on, or would you take it to someone who's tried and true, that you really have a lot of confidence in, or you know that other people have had this, in this case, this test, or you can talk to other people that have had this procedure, so that you can do some fact-finding before you are actually signing up to do this yourself.
Right, no problem with that. And along those same lines, asking, well, what might be some complications, or what are some side effects if you're talking about a medication? Because sometimes it's normal to have maybe a little bit of, say, if you have an incision done, a little bit of loss of sensation just for a couple days, because anytime you cut skin, you're cutting through some nerves. That might be normal and something that you kind of watch just to make sure that it resolves, and not something necessarily that you need to panic about. All right, I knew to expect this, I knew that it might be happening. Or for medication, say for example, a lot of people might take niacin for cholesterol, which works really well in lowering certain kinds of cholesterol, but it can have this flushing that goes along with it. And if you didn't know that to begin with, you might think that it's a negative side effect or even an allergy and stop taking the medication, when if you did know, you could say, this is normal, I know this is going to happen and it's not hurting me, and I'm just going to keep taking it to get the benefits from it. So you want to know what might be a side effect or something that I should expect or something that should be worrisome, and when should I call you? This might be a normal thing to expect and this might be abnormal. When do I need to really follow back up and know?
Right.
That's perfectly acceptable.
Right, right. So they're all good ideas. How about other examples?
I think just simple examples are keeping a list of your medications and even practicing saying them. Sometimes they seem really long and intimidating, and I know they are for us even when we learn them. Sometimes you just have to say them out loud a lot, and that's more helpful than coming in to say, oh, I take that purple or yellow or orange pill. Medications are all kinds of different colors, and sometimes the healthcare provider, not being a pharmacist, doesn't always even know the color of them if they're not taking them themselves or see them on a regular basis. So you want to keep a list of your medications, write them down too, and ask how you spell it so that you know that you're at least talking the same language at the same time, knowing what that medication is for and when you should take it. So can you spell the name of that drug for me, or can you write it down for me, or can you change it on my list of medications? They're really great questions.
I think another part about the medication is that it's really good not just to have a list and keep it at home, maybe near where you're actually taking your medications in the kitchen or the bathroom, but that you have another pocket card, that you really carry these medications with you. Because if you were in a situation where either you were in an accident, for instance, and you were taken to a hospital, or if you were on a trip and suddenly you realize you don't have your medications with you, it's impossible to really figure out what you're on based on just colors and size and shape.
Yep.
And you probably wouldn't even be that accurate with color, size, and shape anyway.
Right.
So having that list that you can just pull out of your wallet or pull out of your purse, that is really a critical variable. And I think that's not something that people think that they should carry with them, like their license, for instance.
It's critical. It's absolutely something that you should have with you at all times, but especially at healthcare provider appointments, all healthcare provider appointments. And it shouldn't be something that you folded up once and stuck in your wallet and never take out again. You really need to review it regularly when you go to your primary care provider and make sure that it's up to date, and that what you have on your list is what they have on their list, and that you know what each medicine is for and why you take it. But that includes over-the-counter medicines that maybe you bought at the pharmacy or local drugstore. They're really important and they can interact with medicines. And any herbal or natural supplements that you take, you want to feel very comfortable sharing those things with your healthcare provider as well. So the full list of every kind of medication or pill or tablet that you put in is just as important as having advanced directives, something that everyone, no matter your age or your healthcare status, everyone should have a list of their medications with them.
Right. So I think we've covered how to really open up a visit, how to have your list of questions that you know you really want to have answered so that you really get the most out of that very short visit. We've also gone through, if you are having tests, you need to know the details of those tests. You need to know how the test is conducted, who's conducting it. Do they have a track record, or are you going to a place where there is a lot of volume of this work so you can feel rest assured that they really do know what they're doing? You want to know what the aftermath of that test or procedure would be. How should you feel? When should you call? What are the signs and symptoms that may not be within the normal range? And you have every right, again, to call for some further follow-up or some special attention around that. I think we've also talked about the medications, how you need to have a knowledge of your medication, that you can say these long names just like anyone else. It just takes minimal practice. You need to have that list with you. And I think that you also need to take someone with you to your appointment if you feel indeed that having another set of eyes and ears, which we've discussed on other programs, could be very, very helpful. And then take notes, really remember the details, and best to do that when you come out of the appointment. Instead of maybe just rushing out and getting in your car and driving home, even just sitting in that office and taking your journal with you, or however you're keeping this record, and jotting it down right then and there is very, very helpful, because it's so easy to forget these details. Or any kind of suggestions that the team gave you, things that you could follow up on. you can get home and you'll be immediately distracted with something.
Absolutely.
And then you'll forget, and you'll not necessarily remember it the next day. You could be a week or two from there.
Right.
Or you may not remember it at all.
Right.
Because life is complicated. So you want to keep this really front and center while it is right in front of you. So I think that's good advice. There are some resources on the web, and we will have that for you on the drnancy.com so that you can go and take a look at these lists for yourself. But I think that really what you are saying, Adrienne, and I think it's great that Adrienne is young in her profession, and she's giving us a lot of advice as a newcomer to the field, so to speak. That she really sees that as she looks at these large populations of patients, whether they're younger, they're middle age, or they're older, that this is a problem, that this is not something that the average person necessarily feels comfortable with. And she can see that all of her education and the education of her colleagues is not really getting the best traction with you, the consumer, unless you, the consumer, really jump into the game. I mean, I think that's really what we're talking about. We are giving you permission, and Adrienne is speaking on behalf of thousands and thousands of other clinicians, that you have permission to really do this, and that it's really your responsibility to yourself and to your family. Your health and wellness will only be enhanced if you can do these things.
That's right. And to kind of make sure that you're doing that and taking your notes, a great way is when your healthcare provider asks if you have any questions, to really give that some time and not just automatically answer that you don't. Really think, do you have any questions? And to assess that, you might say to yourself, well, let me tell you what I think the plan is. Let me make sure that I heard you correctly. What I'm hearing is that after this visit, I'm going to make an appointment for fill in the blank, and I'm going to take this medicine now at this dose for this. Is that right? Did I hear that correctly? Are we on the same page? So having that series of checks and balances can be really helpful before you go, and to jot that plan down. That's going to be really important.
Right. So I think our physician assistant guest today, Adrienne Banning, I got that right?
Adrienne Banning.
Adrienne Banning, sorry. That she has really helped us to put this in the right perspective. And we recognize this is not easy. But if you were to tell somebody that's listening, what's the first thing they could do just to get out of the gate? What would be your parting advice?
I would say ask questions and take notes.
Yes, ask questions and take notes. You can't go wrong with that.
Right.
Adrienne, I just really want to thank you so much for being with us today. It was really a pleasure to have you as our guest. I think you've given us a new term that most people have not heard of, and now they know that the power differential is something that the ball is in their court.
Absolutely.
And you've given them tips on what they can do to really to tackle this problem and to feel more comfortable. That's the whole idea, that you would really feel more comfortable.
Right.
So thank you again for being with us, and I want to thank our viewers for being with us. I hope you learned something today that you can take home with you, use for yourself and your other friends and family members. And remember, with health, all things are possible. Have a wonderful day. I hope you enjoyed our conversation today and that the information will help you in meeting your health goals. Catch this program and other conversations on the website, drnancyrn.com. Or you can write to me as well. I welcome your comments and feedback. Thank you for listening, and join us again. And remember, with health, all things are possible.